some structures for this urinary bladder. Okay. What structures I wanted to keep is like first of all I wanted to add one important structure here called as what the urogenital diaphragm. This is nothing but the urogenital diaphragm. The same diagram what I have drawn earlier. Same thing I am drawing here. This is a urogenital diaphragm. Just behind this urogenital diaphragm, you will be seeing what the perineal body. This is the perineal body. And now coming to the next structure, in front of it would be, I have drawn here one important structure here, like this called as the pubic symphysis. So this is the pubic symphysis, right? And now I want to further keep yes, our topics, our today's topic, that is the prostate. So this is the prostate gland. How it appears in scientific section. Okay, this is the prostate gland, what you are seeing here. Right, and also for this prostate there are few important structures which come and join. Those structures are here. One structure called as what? The ductus deferens or the vas deferens. And also another structure here called as the seminal vesicles, right? Seminal vesicles. The same thing lies on the opposite side also, right? And now from here you will also see one fascia here called as the fascia of renum ilia or the renum ilia fascia, right? Now coming to the next part, I wanted to keep another structure here that is just bent like this here. What is this one? Your next topic is this one. That is the rectum. Okay, I have kept the rectum. And after this rectum, okay, I wanted to keep something else here. What is this? Called as the retropubic fat. Okay, retropubic fat. And within this retropubic fat, I also wanted to add a few more structures, two structures which start from here like this. One is going towards one side of this prostate called as the median puboprostatic ligament, and one was going towards the other side called as the lateral puboprostatic ligament. So these are the two puboprostatic ligaments. And after all these things, you know very well that there is some structure which is covering all these layers. That is nothing but the peritoneal layer, which I will use a green color again. This is the peritoneal layer, which comes and forms the rectovesical pouch and goes in front, right? This is the rectovesical pouch. So this is one of the diagrams to show you the prostate. This is the location of the prostate, right? So this is the anterior aspect, posterior aspect. Okay, anterior and posterior. And this is the urogenital diaphragm. And this is nothing but the neck of the bladder with the urethra. And this urethra, which is passing through the prostate, is called as the prostatic part of the urethra, right? And now I just wanted to show you, this is a sagittal section, I wanted to show you an anteroposterior view. If you look at this anteroposterior view, how this prostate appears. So this is the prostatic gland, so this is the urinary bladder. I will just bring it little forward and I wanted to draw like this. This is the urinary bladder, right? And this urinary bladder will continue downwards as what? The prostatic urethra. Now you can see some small bulges there within this prostatic urethra. It goes down like this as the rest of the part of the urethra. So now I just wanted to keep the same structures here. That is what the urogenital diaphragm. This is the urogenital diaphragm here and here, right? This is the urogenital diaphragm. Let me keep the prostate gland here. So now I am just keeping this prostate here. This is the prostate gland. What you are seeing in anteroposterior view, right? This is the prostate gland, right? And now within this prostatic urethra, you will be seeing some important features. What are those important features? This part of the urethra, what you are seeing, is called as the prostatic part of the urethra. And here lies the internal urethral sphincter. Internal urethral sphincter, which is what? Voluntary or involuntary? It is completely involuntary in nature, right? And now within this prostatic part of the urethra. Here you will be seeing a nice, like double fold of this layer here, which is forming a nice eminence here, called as a urethral crest. And this urethral crest bulges and goes like this. So I am just drawing the same urethral crest here, which is going right. So this part of this elevation within the prostatic part of urethra is called as a urethral crest. But on either side of this urethral crest, you are seeing a nice cavity-like structure, right? This cavity-like structure, whatever you are seeing, just below the urethral crest is called as the prostatic sinus. Prostatic sinus. And within this prostatic sinus, you will be seeing some important structures which open, called as the glandular ducts. So what are the glandular ducts? You will come to know. So these are the glandular ducts of the prostate, which are opening within this prostatic sinus. And these glandular ducts come from the glandular or the inner zone of the prostate. I will tell you next. Okay. And now this central region, what you are seeing, right? This central region, rhomboid shaped central region, what you are seeing, that is called as the verumontanum or the seminal folliculus, or otherwise called as what? The seminal folliculus. You can see the same seminal folliculus or the seminal vesicle here, right? The same thing, whatever it is coming inside and it is opening in this prostatic part of urethra, this seminal folliculus or the verumontanum will show a major opening here in the center, called as the prostatic utricle. This is called as the prostatic utricle. Major opening called as the prostatic utricle, where all the glandular ducts will release their, like their whatever component is there, that fluid which is there, they release into this prostatic utricle. On either side of this prostatic utricle comes now these seminal vesicles which I have drawn. So this means that on either side of the prostatic utricle, you are seeing these openings of the two ejaculatory ducts, right? So this is all about the structure of this, like prostatic part of urethra. However, you know that in the urinary bladder there is some region called as trigone of the bladder. Am I correct? There was some region called as the trigone of the bladder, which was like this, and this was the trigone of the bladder, right? And in this trigone of the bladder, you have seen a small elevation, nice elevation called as what? The uvula vesicae. This uvula vesicae is basically produced, this elevation is created by the median lobe of prostate. Median lobe of prostate, okay? Now the question is, I already told you something called as verumontanum, right? Prostatic utricle, and also now I am saying something about the median lobe. But here you are seeing only like anterior surface and the posterior surface. So now let us start with the theoretical part. Before that, let me label this. What is this one? Pubic symphysis, right? And this is what? Retropubic fan. And whatever space you are seeing here is called as what? Space of Retzius. Okay? And these are nothing but the pubo-prostatic ligaments. Right? And of course, this is the UB or the urinary bladder. And I will write it as the peritoneum, visceral layer of the peritoneum. And now I just write it here, this one as the what? Prostate gland. And this is what? Urogenital diaphragm. And this is the neck of urinary bladder. And now let me write this one as what? Ductus deferens, and this is the seminal vesicle, and this is the rectum. And now I just wanted to label this one as fascia of umbilical. Right? So now I'll just write the details about this in like given the prostate gland. First, coming to the shape. The prostate gland possesses the shape of an inverted cone. That is, the prostate is of the shape of an inverted cone, right? Inverted cone shape, right? Coming to this inverted cone shape, you can see this is the apex of the prostate and this is the base, right? So I will just write it here as the apex. The apex of this prostate gland, the apex of the prostate gland is related to which structure? Urogenital diaphragm, right? Coming to the base of the prostate, this is the base of the prostate which is related to neck of urinary bladder, right? And now coming to the next part, that is like the dimensions. Coming to the dimensions of the prostate gland, it is having 3 dimensions, that is 4 centimeters transverse diameter and 3 centimeters vertical diameter and 2 centimeters anterior-posterior diameter. It is having 4 centimeters transverse diameter, 3 centimeters vertical diameter and 2 centimeters anteroposterior diameter, and it weighs around 8 grams in weight. Right? These are the general dimensions of the prostate gland. Okay? Now coming to the next relations. Okay? Coming to the relations, I wanted to say that the prostate is having 4 surfaces basically. One is the anterior surface, second is the posterior surface, and on either side there are 2 more surfaces called as the inferolateral surfaces like this, right? So anterior surface, posterior surface and the 2 inferolateral surfaces. If you take the anterior surface, the anterior surface of the prostate is related to what? This is what? What is that? Pubic symphysis, am I correct? And behind the pubic symphysis there is what? Retropubic fat. And also in the retropubic fat you are seeing something called as what? The space of. And now coming to the posterior relations, this is the prostate gland. Posteriorly it is having few important relations called as, first is what is this one? Fascia of umbilical, and then comes the ductus deferens, am I correct? And also something is there called as what? The seminal cycle. So these are all the posterior relations of the prostate. Now within this prostate gland, I will just next I will tell you the inferolateral relations. Before going there, I wanted to show you something which is important for this prostate. That is, here for this prostate gland it is covered by some capsule. I will use a different color. The capsule which is tightly adherent to this prostate here, it is just immediately lying outside the prostate. This is called as the true capsule of the prostate gland. This is called as what? The true capsule. And see, this is an anterior-posterior view, AP view of the prostate gland. And this true capsule is further covered by another capsule called as the false capsule. So I will just draw the false capsule like this. So this is the false capsule of the prostate. This is the false capsule of the prostate, what you are seeing. And now if you observe, there is some space between the true capsule and the false capsule, am I correct? And this space between the true capsule and the false capsule is now occupied by an important plexus of veins called as the prostatic venous plexus. It is called as what? The prostatic venous plexus. So this prostatic venous plexus is very, very important in case of the applied aspects of the prostate, which we are going to discuss in the end. Now prostate is there. It is covering true capsule and the false capsule, and this is an antero-posterior view of the prostate. On either sides of the antero-posterior view, that is on either sides of the prostate gland, here over the inferior surface, these inferior surfaces. On either side of the inferior surface, here you will be seeing a muscle here called as the levator ani muscle on either side. So this is one levator ani and this is another levator ani. So inferolateral relations. Coming to the inferolateral relations, so I will write it here. Inferolateral surface or inferolaterally, this prostate is related to what? Levator ani muscle. So now four surfaces, two inferiolateral surfaces, anterior surface and the posterior surface. These are all the relations of the prostate gland, right? Now before going further, I wanted to label this one. This is called as what? Tribone of bladder, am I correct? And now this is called as what? Uvula vesicae. And this uvula vesicae is basically produced by the median lobe of the prostate, right? Median lobe of the prostate gland. And now I just will write it as here. This is what? False or true? False capsule. And underneath the false capsule you are seeing what? Prostatic venous plexus, right? And inner to it, this green color one is called as what? The true capsule of the prostate gland. And now this is called as what? Levator ani muscle. And now coming to the next part, here I wanted to write this elevation. I already told you, this is called as what? The urethral crest. And just below the urethral crest, you are having some eminence here, which is called as what? Virum montanum. Or otherwise you can call it as the seminal colliculus, right? And now whatever region you are seeing here, this cavity, this is nothing but called as the prostatic sinus. And these orange colored openings, what you are seeing here, they are nothing but the openings of the glandular ducts of prostate. Okay? And this major opening, what you are seeing here, this is called as what? Prostatic utricle. And also below the prostatic utricle you are seeing some structure called as what? The openings of ejaculatory ducts. Right? So of course rest of the part, this is called as urogenital diaphragm. Okay, fine. We will leave this diagram aside and now let me show you the other parts of the prostate. So coming to the important other structures of the prostate are, which is very important to remember, is that is called as the anatomical lobes of prostate. The anatomical lobes of prostate has got only 3 anatomical lobes. Only 3. Those are nothing but the 2 lateral lobes and 1 median lobe. Okay, 2 lateral lobes and 1 median lobe. But this is not important for us. The most important thing for what we require is that is called as the surgical lobes of prostate. So the prostate gland is having 5 surgical lobes. Please remember, these are only 3. But here you will be seeing 5 surgical lobes, namely 2 inferiolateral lobes, then 1 anterior lobe and also a median lobe, and also a posterior lobe. What is this? Surgical is having 5 lobes. How to understand this 5 lobes? That is the question, right? For this purpose, what I will take is like, I will take one parasagittal section of the prostate gland, that is a side view, and also I will take a cross section. Suppose like this is a prostate gland. Let us think. I will cut it like this, and I will show you like this. Okay? I will cut from above, and then I will just show you how it looks interior, how the interior of the prostate gland looks. So if I cut the prostate gland, how it looks is like, I am just taking the interior of the prostate gland. This is the cross section of the prostate. This is the cross section, right, where I have cut, and now I am just turning it to your side. I am showing you. But in this prostate gland, in the cross section, first of all you have to see this one. What is this? Prostatic part of urethra. Am I correct? So let me keep the prostatic part of urethra here. This is the prostatic part of urethra. Okay. So this is the prostatic part of urethra, which is coming from the urinary bladder in the cross section, right? Now, simply it is divided into 5 lobes. You can see. I am just drawing 2 margins. I am just drawing 2 margins. This is only a surgical lobe, right? So I am just drawing 2 margins, and I am just dividing this region into like this, keeping it horizontal. So in this way, now you can understand that the prostate gland is having 5 surgical lobes, namely 2 infralateral lobes, right? One is an anterior lobe, which is in front of the urethra, am I correct? And then one median lobe, which is behind the urethra, and the most posterior one is nothing but the posterior lobe. These are the surgical lobes of the prostate gland. Hope you understood, right? This is seen only in a cross section, right? So, but now we want to see about this median lobe, which is creating this entrance, right? That is uvula vessel. If I take a parasagittal section, how it calculates? So I am just going to take the parasagittal section here. This is the parasagittal section of the prostate gland. Now you can see this is the prostate, right? Now see, I am again drawing the same thing, but now there is something here special in a parasagittal section. See, this is like, even though this is so large, the opening is very small, called as the prostatic utricle. Somewhere you have said prostatic utricle. And this prostatic utricle on either sides, it is having the openings of what? Yellow colored structure. What is that? Ejaculated duct. So let me complete this diagram. This is the another lobe of prostate, right? Now I just want to keep the ejaculated ducts like this. Okay. Now it is very clear. In this parasagittal section, I am standing like this. Now the prostate is cut in a lateral view. In this parasagittal section, if you see, it is very clear that this is the anterior lobe of the prostate. Anterior lobe of the prostate. And now the part of the prostate gland which is lying above the ejaculatory ducts. Above the ejaculatory ducts. The prostate part of the prostate which is above the ejaculatory ducts is nothing but the part of the median lobe of prostate, and the part of the prostate gland which is below the ejaculatory duct will be the posterior lobe of the prostate gland. Now what is the importance of this prostate median lobe? So now here I will write one applied aspect here. The applied aspect, that is nothing but it is very, very important for the surgeons. What is this called? Perrectal examination. Any person, basically, this condition is commonly seen in elderly males who generally cross 50 years of age. So in them, what the complaint will be like, they will be coming to the hospital saying that there is some difficulty in urination or micturition. That person is having some difficulty in passing urine. What is the difficulty? We'll ask, what is the difficulty, that kind of difficulty you have in passing the urine? then the patient will say that whenever he is urinating in the morning, he is having dribbling, means urine is coming in drops. There is no continuous flow in the urine. Morning when we go for a urination, micturition, we will have a continuous flow of urine, right? But these elderly males will have droplets of urine which are dribbling down, which means that they cannot pass the urine freely. That is the basic complaint. Once they say that they are having some problem in passing the urine, that to elderly males above 50 years, the first doubt you will get is about the prostatomegaly. Prostatomegaly. For that, in order to confirm the prostatomegaly, you will wear a gloves and you have to do a per-rectal examination. Per-rectal examination. And if you look at the per-rectal examination, this is the region for the median lobe of the prostate, right? So, and this means that the median lobe of the prostate is approximately, I will write it here itself, the median lobe of the prostate is approximately 4 centimeters above the opening of the anal canal. So once you pass your finger to the anal canal and you just palpate it, in case of prostatomegaly, the first part of the prostate gland which you feel is this one called as the median lobe. That is the per-rectal examination. Now I will write it here. That is the median lobe lies 4 centimeters away from the anal canal. This is one applied aspect, right? The second important applied aspect I am going to write with the same yellow colored chart. Like this median lobe of the prostate, what you are seeing here, this median lobe is the common site for benign prostatic hypertrophy, which is commonly seen in males. Just know what I told. But there is another clinical importance that apart from benign means not, it is not non-cancerous, right? It's only an enlargement. But please see, this is the region, which lobe? Which lobe? This is the common site for carcinoma of prostate. So this means that the median lobe is the common site for the BPH, called as the benign prostatic hypertrophy. And the posterior lobe of the prostate is the common site for the development of carcinoma of the prostate, which is a neat question for you, neat PG question. And also it's an MCQ, right? So after this lobes, now I wanted to go into the zones, right? I just told you like this is the glandular duct site only, right? Now you need to understand zones. There are only 2 zones in prostate gland. One is called as an inner zone and the second one is called as an outer zone. So for that I am just showing you this prostate gland, how it appears. This is the prostate gland. So this is the prostate gland, and I wanted to just to make it more understanding, I'll just keep like this. Okay, now you can see this prostate gland. Within this prostate gland, you know very well that in the cross section of the prostate gland, in the center, first of all, what you will see here, what you will see, what you will see, anybody? Already I have drawn this diagram. Ma'am, what? Urethra. Urine has to pass, no? Prostatic part of urethra. Again, here also you have seen the urethra. Here also you have seen the prostatic part of urethra. Same thing you are seeing there. And now the prostate is divided into basically divided into 2 zones, namely an inner zone. An inner zone, I will just use a green color. An inner zone which is surrounding, just surrounding what? The prostatic part of the urethra. And the rest of the zone is called as an outer zone. Now comes the most important concept. This inner zone is having one important content. What is that? What is that? Purple color. What is the purple color one? Malli gatti cheppandi. What is that purple one? Urethra, right? What is that?
Urethra.
Urethra belongs to which system? Urinary system, right? Or the urogenital system, right? Do you know, anybody does have any idea of where does this urogenital system develops from? Basically, the urogenital system develops from the intermediate mesoderm. The urogenital system basically develops from what? The intermediate mesoderm. So urethra is also developing from intermediate mesoderm. And see, a part of this urethra, what is happening is like here, a part of this urethral part here, whatever is there, this is the region which is again developing from the intermediate mesoderm. But this region, whatever I have drawn, it is a part of prostate gland, which means that some part of the prostate gland is also developing from the intermediate mesoderm, right? Now I will just label this one as, this is the part of prostate gland which is developing from the intermediate mesoderm. And you know how the urethra and also urinary bladder, all they are formed? They are formed by the absorption of some ducts called as the mesonephric ducts. So I am just writing it as here as the absorption of mesonephric ducts or mesonephric duct. Okay. Now you can see this is the region of the prostate which is developing from the intermediate mesoderm, which is nothing but it is formed by the absorption of the mesonephric duct. But mesoderm has got a special character. Now what? It can develop, right? It can develop into various structures. Last time we have seen from this mesoderm only heart has developed, right? Many structures have developed. So this mesoderm habitually, as it's a habit for it to divide into different parts, here this mesoderm, this intermediate mesoderm, which is formed by the absorption of the mesonephric duct, slowly started proliferating like this, and see how it is proliferating, and it is completely proliferating within this zone to form the glandular part of the prostate gland. This means that the glandular part of the prostate gland lies in the center. That too, it belongs to the inner zone, and it is a derivative of the intermediate mesoderm, which is formed by the absorption of the mesonephric ducts. This is the most important PG question for you and also MCQ. So now I will write this part as what? The inner zone, and also this is nothing but what? Called as the glandular part. Now the next question is like the rest of the prostate gland, as you know very well, most of the glands they take their origin from ectoderm, endoderm, mesoderm. మూడు ఆప్షన్స్ ఉన్నాయి, ముగ్గురు కలిసి ఒక ఆన్సర్ చెప్తే అయిపోతుంది. ఏదో కరెక్ట్ అయితే కదా? ఎవరైనా ఎనీథింగ్ గెస్ what? Mesoderm boys, what is your choice? Most of the glands come from which? So rest of the prostate as it is gland, it develops from so this region is called as the outer zone of the prostate. Got it? So in this way, the prostate is divided in inner zone and an outer zone. The inner zone is mesodermal in origin, while the outer zone is endodermal in origin. This is what you need to understand in the concept. The rest, if you study in the textbook, you can understand very easy, right? Coming to the next part, that is the arterial supply, that is the blood supply. Coming to the arterial supply of this prostate, the arterial supply basically comes from three arteries, namely the inferior vesical artery, then comes the middle rectal artery, and the last one is immobile, that is the internal ureteral artery. So these are the three arteries which supply the prostate. Now coming to the venous drainage. Venous drainage. Okay, most of the venous drainage goes into the internal iliac vein. Now coming to the next one called as the lymphatic drainage. The lymphatic drainage of this prostate goes basically into the external iliac nodes and also into the internal iliac nodes. And the last one called as what the nerve supply. This prostate gland receives both sympathetic nerve supply, which comes from L1 and L2, and also the parasympathetic nerve supply, which comes from the pelvic plexus of brains. This is all about the prostate gland. But there is something very, very interesting. If anybody of you wants to become a surgeon, this you need to pay a lot of attention for this. I have drawn some diagram here showing the prostate gland, right? This surgical lobes, like anterior, median, posterior, lateral surgery, lateral lobe. But this is the prostate gland, and it is covered by a capsule, and then lies the prostatic venous plexus. Above that lies the false capsule. The problem is here itself. The thing is, like, whenever you just get a case of benign prostatic hypertrophy, BPH, generally we call it as BPH. So any male who comes with a case of BPH, they have to undergo a surgery. That is, like enucleation surgery, which means that whatever like prostate gland is enlarged, whatever part is enlarged, that has to be removed. That has to be scooped out like an ice cream. It has to be scooped out completely. How to scoop it out? How to enucleate? For that purpose, if you are going to cut this prostate directly like this, it will lead to severe hemorrhage where the person will die because of the presence of high vascularity with this prostatic venous plexus. As a result, whenever you want to remove a lobe of the prostate gland or enucleation of a prostate gland, what you will do is, like, first of all, you will give a small nip at somewhere and you will control the bleeding, and then through that space you will completely scoop out the prostate gland. Which means that in case of prostatic surgery, we should never remove the true capsule and the false capsule because they have got the venous plexus and they have got high vascularity. That is the reason why during enucleation surgery of the prostate gland, we should never remove the covering capsules of the prostate gland. Now, you know Akkineni Nageshwar Rao, right? He died of a cancer. That is nothing but, like the prostatic cancer. But he was brain dead for a few days. He was brain dead for a few days. What is this? He died of something which is related to the urogenital system. Again, what is the reason for brain dead? That is nothing but the most common site for the metastasis. This is again another applied aspect. The most common site for the metastasis of the prostatic carcinoma is the brain. Why brain? Why brain? Prostate is somewhere lower, right? Brain is at the top. However, they both related. The thing is, like, these prostatic venous plexus, whatever I wrote, I don't know where I have written it. Right? The prostatic, I didn't write it.